We spend 90% of our time indoors, yet relatively little is known about how health and well-being outcomes are impacted by ambient conditions and design features of our built environment. We are delighted to have Casey Lindberg, a senior design researcher with HKS, who will provide an overview of two current programs of investigation: Wellbuilt for Wellbeing and HKS Living Labs, each attempting to uncover relationships between health and our environment. Casey will explore case studies from the HKS offices in Chicago and London during the session. Over to you, Casey.
Great, thank you, Amber. So as Amber was saying, we spend about 90%, or actually more than 90% of our time indoors. And because we know that the built and the ambient environment affects our health and well-being, this means that every single person that touches design in any way, directly or indirectly, is a type of health official, a public health official. It's just so important, it's hard to overstate, but that's often overlooked. Now, often what happens is when we do study how the built environment affects health and well-being outcomes, we do it in sort of a one and done fashion. So we'll give a POE, a post-occupancy evaluation, maybe just once, not even with a pre, before people move into a new space or a new building. And then we're kind of done. We're done with it. We say, oh yeah, we did what we wanted to with that design, and we move on to the next project. But really what we are is we're a dynamic system as humans, and our built environment around us is also a dynamic system. And what makes it even more complicated is that we have a relationship with that built environment. We have our own daily rhythms. The building has its own daily rhythms. We have our own lifelong rhythms, and the building has its own lifelong rhythms. And so studying how those things interact to affect our human health and well-being, as well as the communities outside of those walls, how that interacts with the environment outside and inside, is a really complicated question. So it's really a disservice to just give a sort of one-time survey after people have moved into a new space and say that that's the best that we can do. It's obviously a lot more complicated than that. And I'm excited that there's a lot of research now that's attempting to solve or at least shed light on some of these more complex questions. So I'm going to talk about a couple projects. The first is funded by the General Services Administration in the United States. This is sort of like the federal landlord with a large portfolio of buildings. And it's a study called Wellbuilt for Wellbeing. And it was, data was collected while I was at the University of Arizona at the Institute on Place, Wellbeing and Performance, led by Esther Sternberg. And then I'll move into a couple of studies, case studies, as part of the HKS system of living labs. So as I talk about these, it's important that we're talking not just about this dynamic relationship between these two really complicated systems, but we're also kind of trying to move the needle away from, not away from, but moving the needle to include more than just avoiding risks. So we know a fair amount about things that are really bad in the environment, really bad levels of certain chemicals. We certainly don't know enough of that, and that's a very important conversation to have. But at the same time, we want to look towards the future and say, how can we optimize a certain situation, a certain environment for health, for productivity, for learning, for playing, for recovery, for healing. So keep that in mind as we go along. The impetus for the Wellbuilt for Wellbeing study was actually in 2010 in another GSA-funded study in Colorado, where they studied people. They put wearables on them. They measured their heart rate variability. They got their saliva samples. They measured their cortisol levels. So they had a couple of physiological measures of stress. They also asked employees at a federal office building how they felt. And what they did was they tracked them as they moved from a really sort of old space that had a lot of problems, loud noise, not a lot of light penetration, into a new space that had a lot of light penetration and lower noise. And they found that physiological responses were better in the new space. So that was really exciting, but because there are so many variables going on, it really led to the question of, well, which aspects were really most important, and is it possible to kind of tease those apart? Because often when you have a new space, there are so many confounding variables at once. So that led to the Wellbuilt for Wellbeing project, and a lot of the outcomes that I'll be talking about are around physical activity, stress, and sleep quality. And we're really interested in that relationship because, to put it simply, they are related. So if you can have a positive impact on, say, someone's physical activity, we are a living, breathing system that has our own rhythms. We take our buildings home with us at night in the way of how we have been stressed, how we have expressed ourselves in terms of physical activity in that building during the day, to how we sleep well at night. So if you can have a positive aspect on physical activity, on stress at work, you should have a positive impact on the other things, including sleep quality while you're away from the office. Same thing goes, obviously, if you have a negative impact on one of those things. So just a quick overview of the methodology that we used in Wellbuilt for Wellbeing. We tracked a couple hundred federal workers in the United States, across the country, in a few different sites. And we just had them go about their daily work, but we tracked their physiology with some wearable devices. So we got heart rate variability, which is a measure of stress. We got physical activity, and we also asked them a bunch of questions in the moment for how they were feeling, as well as some sort of typical survey measures. We also tracked the indoor environment around the person, as well as in the building, sort of where we thought they would be. And we got a lot of typical measures that you might think we would get: temperature, relative humidity, carbon dioxide, sound, and light. And one of the patterns that we first noticed that was pretty exciting was we had a variety of types of workstations. So the sort of open office work setting where there aren't any partitions and you can easily see people next to you, as well as a traditional high-walled cubicle where you're sort of in your space, but it's not a private room, and then private offices. And what we noticed was that workers that were in open bench seating areas actually exhibited more physical activity while they were at the office than those in cubicles, and in turn more than those in private offices. And again, this is exciting because we like this relationship, to affect this relationship between sleep quality, physical activity, and stress in a positive way. And office workers are at a really high risk nowadays in terms of sedentary activity. So we put a bunch of more variables that we could into the statistical analysis, and it did hold up that the office workstation type did affect the amount of physical activity, again, with those in the open bench seating areas having more physical activity. And just like with the Denver study before it, this impacted outcome variables outside of the office. So the workers that had higher physical activity at the office actually had lower stress responses when they were outside the office. So this paper was published last year in the Journal of Occupational Environmental Medicine, and a lot of the press around it was, sort of typically what you would think, oh, now there's something good about open offices. Open offices are healthy for you. Well, most of the press is about how bad the open office is, and everyone hates the open office. So what we really hope responsibly comes from this work is that we start moving the conversation to a little more nuanced, in a little more nuanced way. So saying, well, what can we learn about the open office environment? What can we learn from the cubicle environment? What can we learn from the private office environment to create sort of a design solution that might be a little more flexible and offer a little more types of spaces for people to get their work done according to their own personalities, their own types of work, and the time of day and the rhythms that they're going through with their work and their personal bodies. We also noticed a relationship between relative humidity and stress and sleep quality, which was pretty exciting. So this paper is under review right now, but we noticed that those workers that were exposed to a range of relative humidity the majority of the time, between 30% and 60%, so neither too dry nor too humid, had a lower stress response while they were at the office compared to those that were in drier conditions or more humid conditions. And this indirectly led to better sleep quality at night, both subjectively and objectively rated. So this is a touchy point for people that are really well versed in sort of the HVAC systems, because thinking about negative health effects of dry conditions then leads to thinking, well, now we need to add moisture to the air, and that can add all sorts of mechanical problems. So this is a tricky problem, but it's a really important discussion to have, because so little of the work out there right now investigates the health effects from this really common sort of variable that we live and breathe in. CO2 is also an interesting story. The cog effect studies from the past few years have taught us some really important things about common levels that we see inside typically operating buildings, where maybe in sort of a crowded conference room setting, you might have a lot lower cognitive ability on a complex task than you might when you come into a building and it's more, the levels of CO2 are more comparable to what you would have outdoors. So because CO2 is important, we looked at different rooms within the buildings that we sensed. And we noticed that some of the rooms, even though they were in similar configurations and they had similar systems, were a lot less resilient to sort of flushing out the CO2 over time. So this is I bring this up because it stresses how important it is to not just do a little spot measurement here or there with a sensor, but to have continuous monitoring in each conditioned space. We also work with the Center for the Built Environment out of Berkeley, because we were interested in understanding the CO2 envelope that's around a person's body that develops. So as you're sitting in space, as you might be right now, unless you're outside and there's a lot of air movement around, you will develop a sort of CO2 bubble. And this is a few hundred parts per million more than if you had a very small fan just blowing at you. So this is a new discovery that was pretty exciting. So sometimes a very simple solution can be a really nice solution. And that basically blows the bubble away and lowers it a few hundred parts per million. One more quick finding for the Wellbuilt for Wellbeing program of work is that we were interested in looking at the difference between what we'd call sort of a global estimate, a question on how able workers are, say they are, to be able to focus and be on task while they're at work, versus asking them a question in real time. So if you ask them just sort of a one-time classic questionnaire, how able are you to focus and be on task at work? People in private office say, oh, I'm really able to do that. I do that really well. But if you ask them in real time and you average those responses over the days that they're being observed, you don't see any difference between how focused people say they are in the moment between those in the sort of open office setting, the cubicle setting, and the private office setting. So this stresses the idea that it's very important to study things at multiple layers of investigation. And the next steps of this that'll be coming out in the next year, we'll be looking at different personality interactions with different types of workstations. So things like introversion and neuroticism, and how those affect feelings of happiness and also focus. So at HKS, a little bit about what we're doing that's along a similar vein. We have a program called the Living Lab program. And we have a couple of offices, our own offices, that serve as signature living labs. We have some other offices as well. But the two that really stand apart right now in terms of the amount of measurement that we've done have been in Chicago and in London. And what we do in these living labs is we really try to integrate the designers with the researchers to document design intent for a space that is changing and be able to study that impact. So that's a lot easier said than done, but we're making a lot of progress because to be a living lab, it's not just a one and done thing like I was mentioning before. It's not just that people are moving offices or having a renovation and then we measure it and then we're done. We want to see what actually worked and what didn't work and then continue to improve that situation and measure the impact as we're making new design iterations to that space. So we measure indoor environmental quality with a variety of sensors. We also ask people in real time how they're feeling, what they're up to. We have classic surveys as well. These offices are meeting WELL certification and LEED. We even have energy dashboards that shows energy use for the building in real time, as well as lighting. And we can even layer on different aspects of spatial analysis and modeling a space before people move into a new space or a design aspect has changed. And we can study how people use the space by behavior mapping. So actually recording where people are in real time and what they're doing in that space. And we see a lot of great things happen as we would hope to in a new space. So both London and Chicago have a new space or a renovated space, and both new spaces. And this is, you know, you would expect people to be happier on many dimensions, and they are, and that's a great thing, as well as a lot of the objectively measured things. But what's most interesting to us as researchers are the parts of the space that aren't operating as intended. So there was a space right now in the Chicago office that's not being used as heavily as we had anticipated. So that gives us an opportunity to show with behavior mapping how that can actually change once we made a design intent, documented a design decision, and then study it again. In London, we just got some fresh data just off of survey, but it's still very interesting. So again, lots of things got better as our London employees moved to a new space. However, two things that are very important, they say got worse. So they think that the their acoustic satisfaction went down, as well as their connection to nature. So both of these things are very important, and it gives us an exciting opportunity to say, hey, these things are going to happen. If every single time you move to a new space, everything got better, that'd be extremely unrealistic. So here are a couple of things that didn't work. What can we do? How can we work with the design team to understand what we did, not ideally, fix that, and then measure that again? So really what those two stories really help us do is try to connect design to performance. And connecting design to performance in the smallest sort of time frame as possible is really the ideal standard. That might be, you know, decades away, but what we're really itching to get to as soon as we can. And the last thing I'll say is just that the main obstacle of making that happen is that typically designers, like at HKS, we are removed, unless we're talking about our own office workers, we are removed from the client's occupants that move into a space. And that makes it difficult to have that connection with the dynamic relationship that we can then inform, because we want to move the conversation away from providing a static set of drawings to a person say, this is what we've done for you, go and run with it, to saying, here's an ongoing conversation. Let us work with you as the actual occupants of this living, breathing space to help us understand how we can keep working and making this space a better place for health and well-being. So I'll stop there. I think I went a little bit over, but hopefully that was close enough, Amber.
Thank you, Casey. And thank you all for joining us. As mentioned, this presentation was recorded and will be available on our website. We hope you enjoyed the presentation, and if you have any additional questions, please feel free to contact us.